People will join. Perfect. Have a couple joining. Give it a few minutes here.
So do you want me to pull my presentation up now or just wait a couple minutes?
You can pull it up now if you prefer. That works for me.
Well, would allow us to dive right in.
Yeah, that's great. For those of you on, we're just going to give it a moment, let other people get joined, and then we'll get started.
And there we are.
Okay, perfect. I think now is a good time to get started, and anyone else can just join a little bit after if they need to. From the Ohio Chamber, thank you everybody for joining. We're excited to have you here. We're excited to have Bill present today. Just a quick note, we do ask that if you have any questions, you just post them in the Q&A and we'll get to them at the end. Seeing it's going to be a lot of information, so it's nice to have them in a designated area as opposed to breaking up throughout the presentation. All right, and Bill, if you're ready, I'll pass it over to you.
Well, thanks so much, Megan. It's just a great moment to be with you all. I know that a lot of us really can't control what's going on in DC or, even in our own state regarding mandatory vaccinations and the COVID-19 issue. But I'm here today to kind of give you the cutting edge, what's happened in the last 2 weeks on the issue of mandatory vaccinations, COVID-19 plans, what we're expecting from the various government agencies. And when we
Bill, really fast, someone just said they aren't able to see the video. Is that, are you guys able to see his screen? Yes, okay, perfect. I just wanted to make sure. Thank you guys.
Good. Well, thank you.
Go ahead, Bill. Sorry about that.
Oh, yeah, no problem. So I'm with a law firm, Steptoe and Johnson. We have 30 lawyers admitted in 32 states, and we have a large labor and employment law practice. I have a national OSHA practice and have been doing this kind of work for quite a few years, been very active in the ABA and what have you. And I'll be going down to speak at a trade association next week. So I really appreciate being able to talk with you all and help bring you up to date on what I know is going on in this area. So I wanted to tell you the story of an employer. The employer's name was Jonah Inc. And the governing entity asked for him to do something and gave him guidance. But Jonah ran the other way, and Jonah denied the need to do the requested act. Jonah procrastinated. Of course, we know what happened to Jonah, and it's not surprising that he did not fare well, at least temporarily. So today, Jonah would have needed to have a written OSHA COVID-19 infectious disease prevention and control plan. So no matter what the size of the employer, it's very important that the employer has some sort of written OSHA COVID-19 infectious disease prevention and control plan. So when we look at the elements of this, so this is kind of a packed slide, I admit that. And I wouldn't show this if we were doing this in person, but basically what we're trying to do is plan and categorize and assess and prescribe. And so when we look at the different elements of a COVID-19 plan, First of all, we have to assess the level of risk in our organization. If we have a rural manufacturing plant, there's not a lot of interaction between our employees and people from outside the community, and our community has a low spread rate, that's not exactly going to be a high risk employer. And the fact is that that'd be more like a low or medium risk employer. And so then we have to assess the jobs that we have and what are the specific risks. For example, if people are working very close to each other, then we need to take some action to prevent them from transmitting the disease. Is that masking, or are those barriers, or is that ventilation? There's a wide variety of different measures. Some are engineering, some are administrative, like staggering shifts or having some people work remotely, or work practice controls to keep people from having too much exposure at one time. And of course, personal protective equipment like masks, or like this 3M 8511 that is my personal favorite that I'll talk more about later. It has a valve in the front, but it's approved by the FDA and NIOSH. Then we have, all these OSHA checklists. There's state health department checklists, especially in Ohio. As we all know, we've had a very active State Department of Health. There's CDC guidance. There's EPA guidance about cleaning under List N, all the different cleaning measures. And then also the National Institute of Occupational Safety and Health is the one that reviews and approves N95 respirators. So NIOSH, if it doesn't say NIOSH, or if it's NIOSH is misspelled, you probably have one that isn't legitimate. So as we move then, I want to review the recent actions, and some of these are quite well known. First of all, I just want to say, OSHA received a $100 million appropriation earlier this year. So they are very active in hiring compliance and safety and health officers, called COSHOs, they call them. Some people call them inspectors, but the proper name is compliance, safety, and health officers. And they're going to have quite a few more than they have had. Probably close to 500 or 600 more before too long. And then Doug Parker, who is a longtime employee advocate, was nominated to lead OSHA, and that's still pending, but we expect that the Senate will confirm him soon. And then we had the healthcare, what ended up being the Healthcare Emergency Temporary Standard. And that was published in the Federal Register on June 21st. And the written plan was due by July 6th, with the ventilation and training on the plan due July 21st. So if you're a healthcare entity and you're not exempt from that, and you still don't have a finalized written plan, that's something to which you should give, immediate attention. Because if there's a complaint and OSHA comes by, they're going to expect you to have a plan unless, like I said, you're exempt. If you think you're exempt, you really should document the reason for the exemption. Write a memo why you think you meet one of the exemptions. For example, it's outpatient. We test everybody or screen everybody. We don't let anybody with COVID symptoms in, and everybody's fully vaccinated. It's one of the exemptions. So you would want to document that's the reason. And then there's a national emphasis program on COVID-19 that can be invoked whenever an OSHA inspector shows up. So let's say that you have something happen, like something that causes one of your employees to be hospitalized inpatient. Now, not just at the emergency room, but inpatient. and you have to report that to OSHA within 24 hours. So that would be an occasion for OSHA possibly to send you a letter asking for information, and they might come out, and then they might come out and say, well, we're going to expand this and study what you're doing to protect your employees from COVID-19. So these things can come up. Like, it's surprising how many inspections start on construction sites, believe it or not, with a compliance, safety, and health officer from OSHA just driving by and seeing people working on a roof without uh, lanyards and harnesses, without any kind of perimeter or fall protection, and then they initiate an inspection. So there's a lot of ways that can happen. Or a law enforcement person in some communities here in Ohio, I'm aware that some law enforcement folks have a tendency to call OSHA if they see something that they don't think is safe. So anyway, on September 9th, as we'll all recall, that day, President Biden announced plans to have an emergency temporary standard to require employers of 100 or more employees to require vaccination or weekly testing. Now, whether or not that will be weekly testing forever or whether it will be a certain set of employees, we don't know yet. But the announcement was also made that federal contractors must require vaccinations. And the report was produced on September 24th, and we'll be into that for here in a few minutes. CMS, the Center for Medicare and Medicaid Services, to the extent that entities like nursing homes, long-term care, hospitals, dialysis units, etc., receive funding from Medicare or Medicaid, they're going to have to require vaccinations, but rules to be issued. So that's that. Federal employees, all federal employees must be vaccinated by executive order of President Biden. And then on September 10th, the day after, there was a Department of Labor session with the acting assistant secretary, Jim Frederick, originally from the Steelworkers Union and now with the federal government, and Ann Rosenthal, who's a lawyer who has come back as a consultant. She served for many years as chief counsel to OSHA, and she's overseeing the writing of this emergency temporary standard. And then on September 24th, this past Friday, the Federal Contractor Task Force issued its report. And I just want to mention that, we'd like to read some things into this that OSHA is going to do because of this report. But I just want to caution, OSHA was not on this task force, interestingly. So this consisted of a lot of other federal agencies, trying to take President Biden's order and put it into effect. And or say what the rule is going to be for new contracts. Okay, so let's just talk about what happened on September 10th. Let's go back to that, because that's for employers with 100 or more employees to ensure then that the workforce is fully vaccinated or require unvaccinated workers to be tested at least weekly. These same employers must provide paid time off to be vaccinated or recover from the effects of the vaccination. And some people say, well, why 100? And we'll get into that maybe a little later. But Ann Rosenthal, like I said, a consulting attorney who's overseeing this back as a contractor, she said, we know that we're going to have this emergency temporary standard within weeks, but we just don't know how many weeks. And she just doesn't, because the announcement was made by the president, and then this is the day after. And basically, OSHA then has to write this emergency temporary standard on vaccinations. She said all employers should start implementing, in other words, with 100 or more employees, should start implementing mandatory vaccination policies as soon as possible. Employers, and she asserted that employers can require vaccinations as long as disability and religious exemptions are provided. So, really, for the first time, a spokesperson for OSHA has come out and said, gee, employers can require vaccinations. I don't know if you heard, in the last couple of days, the head of the CDC said that she was, in fact, in favor of mandatory vaccination because it reduces the incidence of disease in the population. Now, the lawyer, Ann Rosenthal, indicated that OSHA will cooperate with the Equal Employment Opportunity Commission, the Wage and Hour Division, and other parts of the Department of Labor to seek consistency in the OSHA vaccination emergency temporary standard. And also, this is always something that employers, I don't know how many of you have had a visit from a compliance, safety, and health officer and then issued citations later, but sometimes they'll come and it seems like it's such an urgent thing, and then you don't get citations for almost 6 months, which is how long they have to issue citations. But again, OSHA, the OSHA in this administration is trying to achieve what they call the expeditious issuance of citations and requirements for abatement so that this doesn't hang on for 6 months or whatever. Not sure what expeditious means, but companies with 100 or more employees will be covered, not just locations or establishments. So, for example, if you look on the OSHA website, if you Google OSHA establishment page, you can look up any company's citation history if you know their name. And you can even look it up, by office and what have you. You should try that sometime, maybe on your own company, and use the different names and make sure there's nothing back there. But you can go back, way back, you can go back 30 years and see what citations were issued for that particular establishment or location. But here, in order to meet the 100 employee or more test, OSHA is going to take the whole company. And even though Ann Rosenthal didn't mention the control test, where if an employer is owning or controlling multiple companies, there is talk that they may aggregate those in other words, count all those numbers to meet the 100 or more employee test. So probably if you do have that situation, you would want to evaluate whether or not you have enough employees in the aggregate to meet the 100 or more employee test. So just be very careful and cautious, because they will dig into this issue if the employer asserts an exemption because they're not 100 employees. They'll look at the history and that sort of thing. The emergency temporary standard will not apply to employees who never come to work, according to lawyer Rosenthal. But it will apply to those who don't come to work but interface with clients or customers, like outside salespeople or engineers. I know a lot of engineering firms who have a lot of remote workers because they travel anyway. So those folks who work out of their homes but visit customers or clients or companies or whatever, they will have to be covered by this plan, so that the mandatory vaccination or testing program, she said it's not known who will pay for the testing, but that will be covered in the emergency temporary standard. There's a couple of schools of thought there. Well, maybe they'll require the employer to pay for the testing. But in some states, not Ohio, but in some states like West Virginia, you're already required to pay for the testing. But that will be covered in the emergency temporary standard. Employers shall provide paid leave to employees to be vaccinated and for any after effects of the vaccination. no statement about whether you'll have to provide paid leave for the testing itself. She also said this will not change collective bargaining obligations for union employers, but that's not really correct because the union employers will have a mandatory vaccination policy that they'll have to implement. And so the fact is, they'll still have to bargain on effects of the vaccination program. And OSHA will not prescribe or comment on employer disciplinary practices. However, as we look at this, and excuse me for 1 second. Okay, here we go. So the public will not see this emergency temporary standard before it's issued. But note the following. The Federal Wage and Hour Division, another part of the Department of Labor, requires mandated time during the business day spent obtaining vaccination or testing to be paid. So that's already a rule. Some state and wage and hour laws may require payments for time to receive testing. And as I said before, effects bargaining will be necessary. And that would be a good thing to get started on. OSHA will not prescribe or comment, but let's face it, every compliance, safety, and health officer that comes to your workplace, if you have rules that you think the employee violated, they're going to ask you, did you enforce those rules? So that your rules, the rules that you come up with, are going to have to be enforced. Remember that there's something called the employee unpreventable misconduct defense. It has 4 elements. 1, the employer has a rule. So a written rule typically, but I'll take an unwritten rule if everybody agrees it's a rule. Number 2, the employer trained the employees on the rule, so the employees know the rule. 3, the employer has disciplined on that rule. 4, the employer has gone out and tried to discover violations of the rule. So the supervisors, just not going out and really actively seeking to enforce the rules, that could be a problem as far as using the unpreventable employee misconduct defense. That could be a real big factor here when we're going to have these very specific rules that have to be followed. Okay, so what are the likely challenge points? Now, I'm not going to spend a lot of time on this, but you've heard a lot about attorneys general wanting to sue the federal government. You've heard a lot about different companies or trade associations. Some have, some employee groups might want to sue the federal government. There's some unions that are anti-vaccination and some, as a leadership group, not necessarily the rank and file. And then there are some that are in favor of vaccination. And like I said, not necessarily the rank and file. So, well, one argument and so I've just tried to list here all these arguments, that the 100 or more employee threshold is arbitrary. Nobody really knows where they came up with it, but, it really has no relationship to actual risk. Some smaller, some larger employers, may have less risk. It does not protect employees of employers with 99 employees and under, obviously. There's a cost benefit assessment that apparently was done. And really, OSHA has fought that in the past. It will cause employees to run to smaller employers to avoid the vaccination or weekly testing. So a lot of employers are worried that if they have to implement this, it will destroy their businesses due to employee flight because there's a large segment of potential employees and current employees who don't want to be vaccinated for whatever reason. And also, there's been the argument that right now there's no grave danger. OSHA said there was no general grave danger when they issued the healthcare emergency temporary standard. And the scientific community, as we know, has been, uneven as far as the consistency of their positions on the various vaccinations. But now, we've got the CDC and the FDA. I think the whole government, federal government, is going to unite and say that mandatory vaccinations are a good idea. So other methods such as PPE, ventilation, or distancing can protect workers. That's been an argument. There's no need for such an emergency temporary standard in outdoor endeavors such as outdoor construction. Some people have said it's a public health issue, not a workplace issue. It violates equal protection to treat a 98 employee business different from a 100 employee business. The risk should be assessed, as OSHA has been saying all along, rather than a one size fits all approach. Some have said that regular notice and comment rulemaking could be carried out expeditiously if the effort was made. And there's no reason to do this as a secret emergency temporary standard. Now, keep in mind that no one's going to see this thing until it's issued. We may get a chance to comment on it, but like the healthcare emergency temporary standard, we were commenting on something we had not seen. So the Office of Management and Budget at the White House, the OIRA panels, we could have a chance there, but we don't really know what the provisions are going to be. Now, the counter considerations are if the pandemic deepens, if more of the hospitals, ICU wards get filled with people, then the case for the emergency temporary standard will seem more compelling. If courts give deference to OSHA, it may be difficult to prevent the standard from going into effect or vacating it once it is. OSHA may present scientific evidence that alternative measures are ineffective or impractical, and OSHA may distinguish the previous cases vacating emergency temporary standards. Even in the popular press, you hear that OSHA's track record on emergency temporary standards is not that great. There have been a lot of them, like the asbestos standard and this sort of thing, that have been vacated. In fact, back in 1999, the court vacated many different limits, exposure limits at one time. But here, the government attorneys will probably say, this is really different. This is a pandemic. So I wanted to go next to the really important thing that happened on Friday. And this is the government contractors. You may say, well, I'm not a federal contractor. But if any entity that of any part of your company does federal contracting, then under certain circumstances, your whole company could be affected. So that vaccination of covered contractor employees, regardless of what the tier is, they're the contractors, subcontractors, sub, everybody down the line doing any kind of federal contract related work will have to have vaccination of covered contractor employees, except under disability or religious accommodation. Now, when we look at religious accommodation, I just want to mention that the bar for an undue hardship in a religious accommodation situation is pretty low. So in other words, someone says, I have a religious objection, and there are many, and many around the country that have been asserted. The employer has only a limited requirement to accommodate that before it becomes an undue hardship. And up till now, unless some of these regulations change it, it's been a de minimis type of, meaning a very minimal amount of hardship to be undue on the religious side. But on the disability side, one thing I want to mention is that a medical excuse not to be vaccinated is a very, very narrow type of situation. Because if you think about it, the people with the comorbidities, the diabetes, the obesity, et cetera, they're the ones that they're saying are required to be vaccinated. And so it's only in certain very unusual situations in which a doctor would give someone a slip saying that they don't or they should not be vaccinated. So, at this point, I just want to mention, Ohio has had some legislative activity in the last several days. There may be some legislation in Ohio that deals with that point as far as what situations need to be accommodated, but we're not sure what that might be, but it could move pretty fast. But the Chamber of Commerce, the Ohio Chamber of Commerce, will keep us all updated. So for federal contractors, masking and physical distancing are required. Each contractor or sub or whatever tier must have a designated vaccination coordinator. Coverage of contracts. You've got the awards and notices of awards, job orders, task letters, purchase and other orders. So if you have a purchase from a federal government entity, and we have, DSCC here in Columbus, and anybody who is initiating a contract, I'll give you the time frames here in a minute, but written acceptance or performance, exercising contract options, any modification is going to give rise to incorporating these mandatory vaccination requirements. Contracts covered by any of these acts, Service Contract Act, Davis-Bacon, concession contracts, contracts in connection with federal property or land. Think of that coverage, and some are saying that because banks, they're insured by the FDIC, and also they issue savings bonds unless they're exempted in the final rules. They too could be covered by the federal contractor provision. So covered employee means any full or part-time employee of a covered contractor. Includes employees of contractors who are not themselves working on the contract. So that's really big because that's very sweeping. So if you have a company and only part of the company is working on the federal contract, then the definition of a covered employee includes all the other employees too. The covered contractor workplace does not include the covered contractor employee's residence. However, unlike what we're expecting from OSHA, an employee who works from home is still covered by the mandatory vaccination. So you can see this is much more sweeping than we're expecting the OSHA to be. Also, the definition of fully vaccinated does not include those who have had the disease, but does include vaccines such as the AstraZeneca that's been approved by the World Health Organization, the Novavax that has received a full series of clinic trials for active candidates. So, they're anticipating that when this goes into effect, by that time there'll be more vaccines that are online. I just want to contrast that though with OSHA's emergency temporary standard for healthcare, where immunity is considered from 3 months after recovering from the COVID-19 disease. So, and there are certain statements at the CDC where, the government recognizes that you're going to have some immunity, but OSHA's rule for healthcare is that it's only for 3 months. But this federal contractor ruling or not ruling, but the task force report indicates that the provisions of your federal contracts are going to require even people who have had the disease to be vaccinated. And all covered employees must be fully vaccinated by December 8th. After that time, the first date of performance, is really from the beginning of a new contract. And if there's a critical mission contract, it must be started no later than 60 days would everybody have to be vaccinated. As I said, just because someone's had the disease, even if it's within the 3 months that OSHA's saying, well, that's no substitute for a proof of vaccination. Can't use an antibody test either as a substitute for proof of vaccinations. Cards must be provided by the employee. So, different ideas a lot of us have had to advise clients, employers about, you could have them show you the card and sign something and countersign it, all that kind of stuff. Can't recommend that on these because the cards must be provided by the employee, and the employee can find documentation. The situation in the report, it says, well, what if the card's lost? People lose things. The dog ate it or whatever happened to the card. And the truth is that, like Ohio has a record of everybody's that's been vaccinated. So the employee can find the documentation, at the state government level. So masks that are consistent with CDC recommendations have to be worn. Snug fitting, multi-layer, respirators that are approved by NIOSH. The masks, let's say, have to cover the nose and mouth. So, when we talk about a mask, we're talking about this, very familiar. When we're talking about a respirator, we're talking about something like this. Or a respirator, this is a Honeywell model. It's a NIOSH approved N95. I find it very comfortable and everything. But remember, if you're going to require your employees to wear, and these are considered respirators for any reason, these N95s, if you're going to require them to wear them as opposed to just voluntarily, you must have a written respiratory protection program under 1910-134 for general industry, and also under construction, because you have to do a medical evaluation. You have to do formal fit testing. You have to do training, okay, of how to self-check. What are the limitations? N95 means that they filter out 95% of the applicable particles. So really, it's something that is not perfect, and the employees have to know that. So if a mask has an opening or valve, so in other words, if a mask like this, and you see them around, if they have an opening or valve, has single layer fabric, and we see those all the time. People are wearing those single layer fabric items. It's not going to work. That's not going to be appropriate. Or thin fabric that does not even block the light. You see that. Or is a face shield without a mask. Or it's a respirator that hasn't been approved by NIOSH. But I will say that my 3M 8511 has received NIOSH approval. So those are things that you have to consider if you're going to have a respiratory protection program. Then, if you're going to let people voluntarily to wear an N95 in your workplace, then you have to give them Appendix D in writing, give them the appendix, and that tells them some of the limitations of respirators like N95 respirators. The employer must determine what accommodation, again, these are the federal contractor guidelines, must determine what accommodation, if any, will be provided for a sincerely held religious belief. Employers are encouraged to incorporate the mandatory vaccination into non-covered employment. Oh, okay. So they're going to be encouraged to do that. But the fact is that covered employees includes the ones that aren't working on the federal contract. So they are covered. In areas of high or substantial community transmission, fully vaccinated people must wear a mask indoors, but do not have to physically distance. In low or moderate areas, no masks needed for the fully vaccinated. So, like if you're in Franklin County, which I think we're still substantial, you would have to have wear a mask if you're fully vaccinated, but we wouldn't have to physically distance. Those not fully vaccinated must wear a mask indoors and in certain outdoor settings. This is very important. So even in outdoor settings, folks who are not fully vaccinated are going to have to wear a mask, regardless of the level of community transmission, and must maintain a 6-foot distance at all times. Exceptions to mask wearing in private offices and other exceptions must be approved in writing by the contractor's duly authorized representative. So if you want to allow exceptions in your private offices, if you're a federal contractor, think about, like construction offices that are on a construction site for a federal contract. And you're going to have people coming in and out of those things all the time. The contractors must also post signage on safety protocols, requiring all to follow masking and physical distancing for not fully vaccinated individuals. And covered contractors are not required to provide on-site vaccinations. All employees in a building must be covered unless the common areas are never used by that employee. So in other words, all the restrooms, the hallways, the elevators, the stairwells, that's going to be a very rare circumstance. And the policy applies to work outdoors. These are all things that employers have been concerned about. Why should it apply to work outdoors? And the only thing I can tell you is, having been working on this pretty much since day one, the old kind of wisdom that OSHA had back in October, and again, I know this isn't OSHA, but I have to mention this, was that N95s are very effective because we're trying to control droplets. COVID-19 wasn't considered to be an airborne disease like tuberculosis, which is a bacterial disease. But, there are COVID-19 molecules going around in the air. And in fact, those are smaller than what is captured by these N95s. They're 0.1 micron, N95 captures 0.3. OSHA said that's no problem back in October. But then when the new administration was coming in, and Dr. Michaels, who used to be in the Obama administration, the head of OSHA, he's a PhD epidemiologist, and he said, you know what? This is an airborne disease. The molecules are floating around in the air. So that's why I think that for unvaccinated people, they're going to require those folks to wear masks outdoors. Now, another thing, let's see. I'm a medical facility. I'm covered by the OSHA Healthcare Emergency Temporary Standard. Then the Center for Medicare and Medicaid Services is going to issue rules, and I'm covered by those too because we take Medicare and Medicaid funding. So I'm following OSHA and CMS rules. Am I exempt from these federal contractor rules? Because we also have a contract with the federal government. No. So this report's saying that where other rules are more stringent, they have to be followed, but following those rules is no substitute for following the federal contractor rules. So the application is for contracts awarded prior to October 15th. The clause must be incorporated when an option is exercised or an extension is made. New contracts awarded on or after November 14th must incorporate the clause. And in between, it is encouraged, but of course, if the rules are available, no. And these are going to be incorporated immediately. All lower tiered contractors and small businesses must be included. As new requirements come out from the CDC, they will take a look at incorporating. And here's an interesting thing. The requirements apply to all state and local areas and supersede any state or federal law. Each tier of contractor has an independent responsibility for compliance. So a number of the state attorneys general are talking about suing, maybe not over the federal contractor issues, but certainly this covers a very large segment of the economy. 30 to 35 to 40% of employers, depending upon, the area of the country, are federal contractors. And so this is going to cover, a remarkably large group of employees throughout the country. So I'm going back now to the OSHA emergency temporary standard. We don't know when it's going to be, 6 weeks, 10 weeks, but not much longer than that. Right now, you should look at having a mandatory, if you're an employer with 100 or more employees, you should look at having a mandatory vaccination and testing program. My prediction, based upon past experience, is that they'll require testing immediately and give the employers some time for the employees to become fully vaccinated. So what does that mean? That means that the demand for testing kits, which is already, off the charts, is going to be amazing. So they're going to have to distribute millions, tens of millions of testing kits. And right now would be a good time to line up and commit vaccination and testing centers, like make deals with, your local CVS's or your pharmacies. Try to make agreements to lessen the cost. Update leave policies for vaccinations and the after effects of vaccinations. OSHA's already told us that we'll be required to pay for leave and for vaccinations and the after effects. Revise policies regarding disability and religious objections and undue hardship. Now is the time to get this in at least roughed out so that you'll be ready. In state OSHA plan states, which would include, Indiana, Kentucky, some of you may be from those states. Michigan is a state plan state. Tennessee is a state plan state, whereas Ohio, West Virginia, Pennsylvania, Illinois for private sector employers are all federal states. In state plan states, review the state laws contrary to mandatory vaccination or vaccination cards that might delay the state adopting the federal standard. They'll have 60 days to do that. In states like Ohio, where we are, Pennsylvania, federal states, and federal jurisdiction states consider whether the federal emergency temporary standard will contradict state regulation in the same area of vaccinations. For example, if there's legislation that says you can't request a vaccination card as a condition of employment, then that is going to be directly contrary, most likely to the OSHA ETS. It certainly is contrary in the case of federal contractors and most likely the CMS covered employers. Review state laws about the compensability of time for the testing and payment for testing. Assess how many of your employees are already vaccinated. You could do that by an anonymous survey. Just use SurveyMonkey or whatever they call that. and try that. How many will resist vaccination by conducting surveys? Like, do you have a religious or disability objection? It's anonymous. You're just trying to get some numbers here. What is the extent of the issue? Regardless of the above, please make sure you have a written COVID-19 plan, no matter what the size of your company, even if you're under 100 employees, even if it's only a couple of pages. Train your employees in all aspects of COVID-19 disease prevention and the effects that can occur when an employee gets the disease and survives, because there are now very well known long-term effects such as heart effects, lung effects, memory effects. There have been 52 at last count effects from people that they've recovered from this COVID-19 disease. They did not have the vaccination, but they've recovered even with mild symptoms, and they have some long-term residual symptoms. How long are they going to be? We really don't know, but 6 months, 8 months, 9 months, a year have been documented. And so that's an additional incentive. People don't think about that. Oh, I'll just get the disease and become immune instead of taking the miracle vaccinations that we have. Okay, that's a choice that they can make. But the problem with that choice is when they get through that, they may not even be able to walk out to the mailbox without becoming short of breath. And that's something that is a reality that a lot of people aren't being trained about. And you can have a doctor come in and train your people, or send them to a local healthcare facility, and they will train your folks in those issues. So when we look then at, excuse me, I hit the wrong button. When we look at this is well-known information. Everybody knows this. And of course, the boosters are approved for anybody 65 or over, plus people that have comorbidities and suppressed immune systems to a limited extent. Just wanted to mention the Equal Employment Opportunity Commission frequently asked questions. It's right there on their website. Requesting proof of a vaccination is not a disability related inquiry, but subsequent questions to that may elicit information about a disability. So merely asking for a vaccination card is not disability related. The question is the vaccination card a medical record? To the EEOC, pretty sure it is. Most likely it is. And it's a record that has to be kept for sure in a separate file. So that according to the Equal Employment Opportunity Commission, then requesting proof is not disability related. But once you have a copy of that card, you need to keep that in a separate file. And certainly for the length of the employee's employment and somewhat thereafter. If vaccines are mandatory and the employee cannot be vaccinated due to disability, we have to perform a direct threat to health and safety analysis. So that's according to the EEOC. What is the direct threat of a person who is not vaccinated in your workplace? It depends on your workplace. If it's outdoors, construction, maybe not that big of a threat, but if it's healthcare, it may be a huge threat. If vaccinations are mandatory and the employee can't be vaccinated for religious reasons, we must provide reasonable accommodation unless it would impose an undue hardship, which is what I was talking about before. An undue hardship in a religious accommodation is a fairly low standard, but many, many, many folks around the country right now are asserting various religious reasons for an accommodation. And there are a lot of defense attorneys like myself around the country who have developed strategies for those to take into account those folks' religious beliefs and what have you, but yet taking care of the employer's interests. So when we think about workplace guidance, and we think about treating people differently who are vaccinated versus unvaccinated, back in January, OSHA said you couldn't do it. And then May 13th, the CDC said, yeah, you can. You can treat vaccinated people differently. And then OSHA adopted that on May 17th. Clearly, in all these requirements or all these expected rules I've talked about, vaccinated people are going to be treated very differently from unvaccinated people. But there may be state laws that prevent that. There may be interesting state laws in the state of Ohio soon. We just don't know what those will be. But clearly verifying, if you're a federal contractor, we know that merely looking at a card, electronic sign-in logs, attestation forms, the honor system isn't going to work. You're going to really need to retain that card as evidence so that if the contract auditor comes around, you're going to have something to prove that you're enforcing this. The vaccination card, I said before, EOC wants it in a separate file. But for the OSHA situation, if it is an OSHA medical record, that would have to be retained for the period of employment plus 30 years. If it's not an exposure record, as some defense lawyers will argue, then you don't have to retain it for that length, but you would go back to the EOC in a separate file. But we don't know whether OSHA will say, we hope they'll tell us, whether or not a vaccination card is an exposure record that has to be kept. We say, well, common sense says it's not really an exposure record, like, a record of air monitoring or something like that. That's an exposure record that has to be kept for a period of time. And there are state laws against requiring a vaccination card. Remember that there's a current wage and hour division, the federal wage and hour folks have already said that employers must pay for mandatory testing time that occurs within the workday. So if you have folks testing within the workday, the wage and hour division at this point so far has said that's compensable time. It's just like if you require someone to get a vaccination during their workday, according to the wage and hour division, that's compensable time. So I know that we are close to the end here of our time together, but I really have appreciated the chance to go through this, and I tried to get through it pretty quickly. But now I'm going to unshare my screen and try to answer a few of our questions that we have. Megan, any comment before I get into the questions?
No, just the note that there are a few in both the chat and the question and answer, so we can look at both of those for you. But thank you, that was great.
We'll try to, I'm going to work on the chat here. We will give a copy of the slides to Megan, point of time, the date will be measured. Yeah.
The recorded presentation will also be online.
Yeah. So when will the employees be measured? Boy, that's a great question. I would say anytime the employer has more than 100 employees or more will be a time where they will have to apply the emergency temporary standard. And another question is, are seasonal employees or temps included in this figure? While they're, when we think about OSHA, all right, we think about the application of safety standards applies if you have one employee. Now, you may not have to keep records. You may be in an office situation. You don't have to keep a 300 log. But those are you have application. Now, are seasonal employees or temps included? Well, while they are seasonal employees, while you have temps, I would fully expect them to count those. So if your employment goes up and down throughout the year, you're going to need a written plan of compliance. We're going to need one anyway, but a written plan of compliance with this standard so that you can either just follow it all the time or try to find whatever exemptions there might be, which we don't know of any, but we will look for exemptions to see if those will cover the seasonal, especially temp employees. They tend to be a little steadier. If the employer is paying for this and FFRCA expires, how do small businesses handle this extra cost? And it is the cost of having someone get the vaccination, and then if for some reason they feel that they have after effects, those will definitely need to be compensated. And unfortunately, there is no federal funding or provision that helps businesses. Keep in mind that the term small business can be from 50 to 1,500 employees. So, even employees with 2, 3, 400 employees, depending upon the industry, can be considered by the Small Business Administration a small business. So this 100 employee item is really fairly limited in its analysis. If an employee works a week but is then unable to get a vaccine and test results are returned the following week, we really, in these kind of specific situations, we're going to have to await the emergency temporary standard. But this one, since the employee is not able to work, then any workday following the 7 days would not require pay since the worker could not work. Correct. Here, let me go back here. That's very interesting. If an employee works a week, is then unable to get a vaccine and test results to return the following week. Well, I don't think that, that scenario may or may not be covered by the OSHA emergency temporary standard. I think that it's not like the healthcare standard where we're paying for medical removal benefits. And we would have to, like how long do you have to cover the after effects? And that's a good question. The answer under the healthcare emergency temporary standard is there is no time limit set forth in that standard for someone who is off on extended leave from medical removal protection benefits. So that's an OSHA standard. So we're not sure what this standard will say. Right. How will that be handled? Well, that's exactly what they're talking about. Debbie asked, what happens if the employee has a bad reaction to the vaccine? And I'll get to the one before that here in a second. And is out of work for a month or more, how will that be handled? I think I'd have to say that if it's a month, it's probably going to have to be covered by the employer. Now, will the government come up with some funding or help mechanism? We don't know, but right now it doesn't seem that way, and it seems like the employers will be bearing these costs. Now, let's see. Okay, right. How would you verify? And this is from Monica. Hi, Monica. How would you verify an employee has side effects, or do they just have to tell you that they don't feel well? and you have to pay them for however long they say they don't feel well. Well, certainly one would hope that there would at least be a need for a doctor's slip specific to this issue issued, because uh, we wouldn't want a world, and I hope the government doesn't want a world in which it's just on the employees say so. But certainly, if we would be pushing for the right of the employer to have an independent medical examination, you know, that's true under the ADA under certain circumstances, under workers' comp. You know, the question is, would this be covered by workers' comp if they're out? Is this going to be recognized by the Ohio Bureau of Workers' Comp? Well, you know, COVID-19 disease has been, certainly. So it remains to be seen. But there may be funding mechanisms like that, or it may be that the federal government will have a rule that says that you could get an IME if it drags out, you know, too long. Yeah, what about businesses being sued? Now, interestingly, that is, well, that's a great question. And there may be some state legislation on that. OSHA and, you know, the Department of Defense and all these other than regulating federal contracts or regulating the workplace, they have no power to say that employers can't be sued. But state legislatures like the Ohio General Assembly do have that power. And it could be, I don't know, but it could be that there will be some sort of law that permits or that allows employers immunity from suit in connection with vaccination programs. We don't know if that will happen, but it's certainly something that's come up before here in Ohio. I think that in the Q&A, I think I got all the chats. Okay, the slides regarding masks. You know, good question about the Bureau of Workers' Comp masks. The cloth masks, I will just tell you, that are single layer fabric would not meet the requirement for federal contractors, because they're single layer. There has to be multi-layer fabric. And so, you know, like the different bandanas people use and everything, that's just not going to work according to the federal task force. Now, we don't know what OSHA will say, but OSHA has other guidance that indicates that multi-layer masking is really what they're looking for. That's already there, and that just the single layer coverings are not sufficient. We are a nonprofit that receives federal grant funding and have more than 100 employees. Is grant funding considered a contract? And that is, you know, that's one of the questions that we have submitted to the Department of Defense, for example, as of last Friday, to find out, first of all, if nonprofits are covered, okay, because that's a question. And then the question is whether or not grant funding itself is considered a contract. Now, there may be some exemptions at the end of the day. For example, it's possible banks might be exempted, but right now we don't see that. It's possible nonprofits will be exempted. Right now, we don't see that. Grant funding could very well be a trigger for the application of the federal contractor rules. Now, employees having 100 or more employees, the OSHA emergency temporary standard, separate and distinct from the federal contractor rules, or the Center for Medicare and Medicaid Services. The OSHA emergency temporary standard, if you're a nonprofit that has 100 or more employees, then regardless of whether you receive federal funding, then you would be covered. There's no indication that nonprofits would ever be exempt from an OSHA standard. In fact, it's clear, having worked for a number of nonprofits in the OSHA arena, that they are not exempt. So those are things that if you're not covered as a federal contractor, you would still have the 100 or more employees on the OSHA. Remember, if you're a federal contractor, it doesn't matter how big you are. You could have 2 employees and you could still be covered by the federal contractor rules that I've talked about here. Whereas if you're not a federal contractor, you're not a healthcare entity receiving Medicare and Medicaid funding, you're going to be under, if you have 100 or more employees, you'll be under the OSHA emergency temporary standard, unless you meet some sort of exception that we're not aware of right now. So I think at this point, Megan, I think I've answered all the questions in both boxes. And I just want to say something about the Ohio Chamber of Commerce. I realize our census is dropping, but the Ohio Chamber is the most effective all-employer organization in the state as far as advocating for employers large, medium, small. And they are working every day of the week over at our Ohio General Assembly, making sure that employers' concerns are heard. If you have any concerns, which you may, about the things you've just heard as they affect state law or state mandates or whatever, or the refusal to allow mandates for that matter, you should contact the Chamber of Commerce and you should tell them about that. And they'd really like to hear from you, wouldn't they, Megan?
We would love to. That's what we're here for.
I've worked with the Ohio Chamber for 40 years. And I've written amicus briefs, friend of the court briefs, the Ohio Supreme Court over the years with others, joining with others on behalf of the Chamber. And the Ohio Chamber of Commerce is a great organization. And we're so glad that we had the opportunity today through them to help you hopefully understand what's going on. Thank you very much.
Thank you, guys. Thank you so much, Bill. I don't think there are any other questions, so I am going to end this for all. Thank you, guys.
Have a great day. Bye-bye.